Thank you. So today we're going to be discussing OSHA 1904, recording and reporting occupational injuries and illnesses standard. And we're going to answer these important questions. What is a recordable injury? What is a reportable injury? What is a lost day? What is a restricted workday? We'll also be reviewing the OSHA 300 log so you can properly complete that. We're going to be looking at the definition of a medical treatment versus first aid. And when is the company required to notify OSHA of an employee injury? So compliance with OSHA record keeping is definitely something that's important for all companies. And we're glad that you're here today to learn more about those topics. Before I introduce the Small Business Development Center, I will just remind you that we have muted all the participants and we've disabled your video. So if you have a question for our presenters, please enter them in the Q&A. We're going to do our best to answer those questions today. If not, of course, we can always follow up with additional information. If you have a question for me, your host, I just ask that you use the chat feature or the chat window to ask me a question. And of course, we are recording today's webinar and we will be sharing the recording with you along with all of the slides. So introducing you to the Small Business Development Center, we are a grant-funded program with a mission to help businesses start, grow, and succeed. We provide education, information, and tools to help you, our business owners, make better business decisions. What we do, we provide one-on-one business consulting services at no cost. And we also provide training that's either no cost or low cost. Of course, our consulting services are provided at no cost, as I've mentioned, as well as confidential. Our training seminars typically are really on a variety of topics that target the needs of our small business owners. So if you have a need for training, we encourage you to let us know directly or through our evaluation at the end of today's webinar. So the Small Business Development Center, our target audience are small business owners. However, when we define a small business, we define them as a business, generally speaking, with less than 500 employees. So I'm sure you're going to see that the majority of businesses in our region are ones that we can serve. We also use our funding to provide access to database information and resources to conduct industry and market research, marketing strategy, implementation, and finally, financial analysis, just to name a few. The Small Business Development Center, we are part of a larger economic development ecosystem. All of the economic development programs that we work with are here to serve you. And we are here to connect you with many more resources beyond the SBDC, like OSHA, to help you start and grow your businesses. Just one more slide on the SBDC. We're a statewide program in Pennsylvania, also a part of a national program called the America's Small Business Development Center. So no matter where you are across the United States, there will be an SBDC that provides services to your region. In Pennsylvania, our centers are hosted at colleges and universities. Take a look at your county and the SBDC that covers your region. One other note, there is a program out there that does fund training for businesses, for the employees of businesses. That program is called WEDNET, Workforce and Economic Development Network. My center is a WEDNET partner, and so if you currently pay for training of your employees, I'd encourage you to look into this program by contacting us or any WEDNET partner across the state. There's a number of them. Take a look at the program. As far as being eligible, your company needs to be eligible through the program. We can help determine that. The employee needs to be eligible, and of course, the training needs to be eligible. So take a look at wednetpa.com for more information, or just contact the Small Business Development Center here. This is the contact information for both my center here at Penn West Clarion, as well as Gannon University SBDC, and we're joined today from Gannon by Sandy Wheeler. And so let's get started. I'd like to introduce you to our speakers. Mark Harmon is the Compliance Assistant Specialist with the Federal OSHA, and his office is in Erie. And then we're also joined today by David Yashanasek, and he is the SHARP Outreach Coordinator. SHARP stands for Safety and Health Achievement Recognition Program, and he leads the Pennsylvania OSHA Consultation Program, and that's hosted at IUP. So with that, Mark, I'm going to turn it over to you.
Okay, thank you. And good morning to everyone. Today's topic, OSHA record keeping, we have done in the past, and I hope today you will be able to get information that could improve your record keeping ability for your company if that's something that you're responsible for. Again, the slide presentations that we do here for the SBDC, we do make available. So after today, I'm sure that'll be sent out to everyone. But at any time, if you have questions when we do these types of presentations, use that chat function. I have it up here on one of my screens. So if you have a question, post your question in the chat and I will try to answer it as we go along, because that'll help improve the session as we try to answer those questions that come from the audience. So if we can go to the next slide. Today we're going to talk about the OSHA forms with respect to record keeping, which if you don't know, the OSHA 300, 300A, and the 301. We will also talk about the basic record keeping requirements. Again, when I say the term record keeping, that does not apply to all companies that fall under OSHA jurisdiction. So again, you need to understand what those qualifiers are in order to be responsible for the record keeping requirements. We will review reporting requirements. And I know some of these words today we go through may be confusing, but there's going to be 3 separate parts to it. The record keeping, reporting, and then the final topic we'll touch on is the electronic data submission. We do have a new bullet point I put there at the bottom. It says that there have been changes with the data submission, and those changes do go into effect January 1st, 2024. So if you don't know about these changes, I hope this will help you because they were only announced last week, and I'll get to that when we get to the slide on that particular part of the topic. Next slide. 1904 is the OSHA standard that deals with recording and reporting of occupational injuries and illnesses. It requires employers to record, report, and or submit data for work-related injuries and illnesses and fatalities. Each of these requirements have exemptions, limitations, and specific qualifiers. So when I say that, when we talk about record keeping, there are exemptions, meaning that you're not required to do this particular part if, as an example, you're a small company, or if you're in a particular industry that is exempt, and it in most cases is because you are deemed a low hazard industry. And again, I'll try to, with the time we have, explain what some of those may be. But when I say low hazard, think of somebody that has a job that like works in a library, or someone who is a florist, I know is on the list, right? So again, in a work environment that's not very hazardous, specific qualifiers are spelled out, and I understand, they're not always easy to understand and read when you look at the regulation, but we'll talk about these as we go through it. But just remember, always ask the, who, what, where, when, and why type questions when dealing in record keeping. That'll help you, I'm sure, immensely. So let's go to the next question or next slide. This form right here is the one that most people that are required to do record keeping should be familiar with. This is your OSHA Form 300. It has a lot of information on it. And again, reading left to right, there's columns A through L. As you can see, it does have instructions that come with this form, which can be found on the OSHA webpage. I tell people that, record keeping is probably one of the most common questions that the OSHA office would get every day from the public, right? So the phone rings, I answer the phone, I'm from OSHA, how can I help you? And probably 3 out of every 5 phone calls we get are something to do with record keeping. So again, it's going to be, hey, I had an accident at work and I need to know if it's recordable. And I'll say, okay, yeah, let's talk about it, because it has to be of a specific type, a level of seriousness. It has to be defined as something that is a recordable case for it to go on to the OSHA log. Again, so reading left to right, again, you're going to put the employee's name, their job title, the date of the injury, all pretty easy to understand. When you get over to column F, again, reading on the form itself, it does give some instructions that you should be familiar and you should be reading so that you understand. Just as an example, column F says, describe the injury or illness, part of the body affected, substance, object that directly injured or made the person ill. So it actually gives an example. It says, right, a 2nd-degree burn on their right forearm from an acetylene torch. That's a very good description, because what we run into, OSHA, what we run into typically when there's an issue of a column F description, somebody will write down fracture with no other description. Like, well, what was fractured? What body part? How was it fractured? So again, that column F is very specific in that we want you to describe what it was, where it happened, and what caused it. So, but again, going again left to right, you get over to column G, H, I, and J. This is a particular part of the form that will classify the case of the injury. And again, the examples we have here, and this can be found on the OSHA webpage, so as to give you some better understanding. The second case there talks about someone who was poisoned from lead, and as you can see under the second entry, there's a check mark on column H, meaning that the employee had been away from work. So that would make something a recordable case. To make something recordable, it needs to rise to the level of seriousness, which means anything that would, obviously, anything that's a fatality, if it's days away from work, if it's restricted work, transferred, or it does have a column there under J for other. But again, if the particular injured employee is something that is not any of those 4 categories, it's not going to be recordable. A fatality's, I think, pretty specific in definition, right? It's when an employee is killed at work. The days away from work is something also you should be familiar in how to define that. We never count the day of the accident, because technically the employee has been at work when the accident occurred. But if they do miss work the day after the incident occurred, then that would be defined as days away from work, right? So the restriction or transferred, again, is defined when the employee is unable to do the job that they have been assigned. So think of something like light duty. Light duty would be a job transfer. The column J there where it says other recordable cases is something that's not described in any of the 3 previous ones, but it still would be something that would involve perhaps medical treatment, right? So they weren't killed, they didn't miss any work, they didn't receive any restriction or transfer, but they received at least medical treatment for the particular injury. So column J can be something that is confusing because you're looking at it and you're saying, well, yeah, they went to, we'll say the emergency room, but they were able to come back to work tomorrow. And I'm going, okay, but when they were at the emergency room, what care was provided? Because again, if it meets that definition of medical treatment, then that makes it recordable. Okay, so medical treatment is one of the hurdles. If you reach that, that makes it recordable. When I say medical treatment, we don't record things that are first aid. And on one of the future slides, I have a list of what first aid is according to OSHA. But to record an injury at work, again, this is the form that you would use, the form 300 log. Sometimes we call it the OSHA log. Let's go to the next slide. As I said before, first aid treatment is not recordable according to OSHA. And again, it's a common question that we get when people say, well, we only provided first aid to the injured employee. And I'm going, okay, well, I don't know what you did, but you're telling me it's first aid. And according to this list is available on the OSHA website. I did make a QR code there in the upper right corner so you can find this web page that will list these. But there's 14 specific types of first aid treatment that if this is the level of treatment you provided to an injured employee, this does not rise to the level of medical treatment. Okay. So as an example, just to, I guess, use one, if employee cuts their finger, and even if they are taken to the hospital in the emergency room and the medical professional doctor provides treatment, and the end result is the employee simply gets a Band-Aid or a bandage, and they say, you know, take the rest of the day off, you're okay, you're able to go back to work. Well, I described a few things there. They went to the hospital. Just going to a hospital doesn't make anything medical treatment, because again, the example I'm using here is they were able to stop the bleeding and they were able to use a Band-Aid or a bandage, which is, as described here by the list, that simple first aid. That doesn't rise to the level of medical treatment. So think of first aid as things that you or I could do. I'm not a doctor, medical professional. So again, first aid is not medical treatment. Even if the doctor's the one that does it, it's still not medical treatment. Now, to make something medical treatment, using that same example, say if they're in the emergency room and it's bleeding, but they can't get it to stop, so they have to use a stitch or a suture. Okay, guess what? That's medical treatment, right? Because I can't put in stitches. So again, something very small, difference in the amount of medical care that's provided, can go from something that's not required to go on the OSHA log to something that's now a recordable OSHA case. Prescriptions, say if the employee goes to the hospital, same scenario, got the Band-Aid, and they said, yeah, you're fine. But oh, by the way, here's a prescription for, you know, something that's a painkiller or narcotic. Guess what? That would be medical treatment. So that needs to be recorded, right, as an injury. So again, record keeping is very specific, but again, it's important for you as the record keeper to understand some of these mechanisms that trip the recording of the particular case. So first aid treatment, you should sort of have this posted up on your bulletin board close to your desk if you're the record keeper for your company. So let's go to the next slide. There are such things as privacy cases. Again, this is important as someone who does record keeping. It does say for privacy cases, you as the record keeper, you must keep a separate confidential list of who this person is and a case number. So what we're telling you is on your OSHA form 300, if you're filling this out, there are certain particular types of cases that may be recordable, but we deem them to be a privacy issue, and you don't want to identify the employee on the OSHA log. And again, I tried to give you a list that's available at the very bottom there. On the bottom left is the actual OSHA standard where this list is from. So again, the one that comes to mind, if you can look at the first one there, talks about something that would be of an intimate body part, or something resulting from a sexual assault. Like think of a crime, an actual criminal offense that happens at work. Still could be, right? It's a recordable injury. But because of the nature of that, right, you don't want to identify the employee by name. So again, we do have a definition for what is considered a privacy case. Same thing with HIV, hepatitis, tuberculosis. Again, these are medical cases that, because of their sensitivity, OSHA does have a mechanism to remove the employee's name from the OSHA log, but the company must keep that on a separate sheet that's not available. So again, privacy cases, again, it doesn't happen a lot, but you should, if you're the record keeper, you should be aware of this. So if you do have something that is along the lines of what is listed here in the examples 1 through 6, you can exclude the name from the OSHA log. Let's go to the next slide. This is our second form. This is called the OSHA form 300A. Again, this is a form that's available on the OSHA website. You can download this. This is sometimes referred to as the summary sheet. And if you can see, looking on the left side here, what this form is for the company to complete at the end of the calendar year. You would go to your OSHA 300 log, and then from that, at the bottom, you would take the totals, right? So for column A, column B, column C, right? So you're going through and you're adding up the columns G through L is numbers. This is the form that you would take those numbers from the bottom of the OSHA 300 and you would put them onto the OSHA 300A. There is requirements on the right-hand side, as you can see over here. This must be filled out. The company name, the NAICS code, your number of workers. One of the most important parts of the Form 300A summary is at the bottom where it has a place for a company official that must sign and date this form, and it must be posted. This is the posting requirement as well for record keeping, starting in the month of February 1st through the end of April. So it must be up for, a period of about 90 days. This is the form that is required to be posted in a prominent location where the employees have the right to see, to view your OSHA 300A. Let's go to the next slide. This is the OSHA form 301. The 301 form, I'll say, is the incident report. So for every OSHA recordable, right, every entry that you put on the OSHA log, there should be a form 301 incident report, or it is acceptable to use your workers' comp form, right? When you file a workers' comp form for a particular case, right, you're going to fill out information specific to that incident. So there is language that does say the OSHA 301 is an OSHA form required for each incident. However, it can be substituted if the same information is contained in the workers' comp form. So in my experience, the 301 not every company uses them. What they do, they will use their workers' comp paperwork for the particular incident, and that's fine as well, right? So again, this form is required. However, it can be substituted for the workers' comp incident report, which is going to have the same information on it, right? Who it was, when it was, how did it happen, what type of injury, right? So it's going to go into much more detail than what the OSHA log would have. Remember when we were talking about that column that gave a description? The incident report will go into much more detail. So, and again, the 3 forms that we've talked about so far, they are available on the OSHA webpage. You can download those. I know there's companies that have software packages that, they don't use the written paper forms anymore. They do it all on the computer, and that's fine as well. Again, it's going to have the same information, and it's going to be acceptable. Let's go to the next slide. There is a short OSHA video on record keeping. I point this out because, again, sometimes people, this is good in the learning process. If you're not familiar with some of the record keeping requirements, and again, today, I apologize, we're able to, in this session, talk about a particular topic, but this is not a comprehensive training session on record keeping. If you've noticed, we're going through some of this quickly, right? We're touching up on the forms for a few minutes, and then we're going to the next slide. There is a OSHA has a YouTube account, as you can see there at the bottom. That's the link. I put the QR code at the top as well. This video, I believe this was only put together like within the last year, but it says 16 minutes long. So it's a good video. Again, a brief tutorial. And if you haven't seen that, I would encourage you to check out the video. We don't have time today to go through it, but again, after we finish this morning, today, tomorrow, sometime later, check out the video. It may answer some of the questions you may have. Let's go to the next slide. Someone said the link is not clickable. I would say it's not clickable while we're presenting, but if you have a copy of the PowerPoint, yeah, I did connect the hyperlink, or the QR code definitely worked. I checked those yesterday. So, there are exemptions. Remember when we first started, I said, remember record keeping has exemptions. So the first exemption we'll talk about is small employer has a partial exemption. And let me describe that first. When I say partial, with the record keeping requirements, what we've talked about so far is recording, what we're putting on paper, right? The forms, the 3 forms that we have. So when I say there's an exemption for companies who have 10 or less employees at all times, that's a ceiling, right? So if you've got 10 or less for the entire year, you would qualify for the partial exemption. Why is it partial? Well, because what you are being exempted from, because you're small, is the recording issue, right? What you're putting on the paper. So the forms, the 300, the 301 to 300A. But what you are not exempt from is the reporting. That's the part where if you have a fatality, an inpatient hospitalization, an amputation, or loss of an eye, all companies, no matter what size, as long as they have 1 employee or more, all companies have to do the reporting. Okay. There's another slide in the future that'll reinforce this, but small employers have a partial exemption on record keeping. What that exemption carves out is for recording. Okay. So let's go to the second bullet point. It does say industry partial exemption, and there's a list, right? So if you are in a particular industry, remember we talked about the florist and the people that work at a library. Okay, this is the other type of partial exemption. So again, the only thing that is being exempted is the recording, what goes on the paperwork, the forms. But if there's a workplace fatality at a florist, yes, the company has to report that to OSHA. We'll talk about that in a future slide. But if you need to find out if you're on the industry exemption list, it's in Appendix A of Subpart B. And again, I have a future slide that'll list those. But the last one there says keeping records for other federal agencies. Yeah, we know that. Let's go to the next slide.
Hey, Mark, we have a question in
Oh,
our
I didn't see that
Q&A.
one. Yep,
That's okay. It says, can you please explain again, when do you use the 301 form versus the 300? Or are you supposed to fill out all three forms during
oh yeah,
the course of construction?
absolutely. Yes, I should have mentioned. Yes, if you are in the category of required to do the record keeping recording, yes, what you would do, you're going to fill out all three forms is what you're going to fill out. So you would start with the 301, right? The incident report. Once you get that completed, you would then put that information onto the OSHA log, which is the 300. You would put that entry onto the log. There is a requirement that that OSHA log must be current to within 7 days. So if there was an incident today, you have in 7 days to get that entry onto the log. Okay. But the 300A, the summary sheet, that is what you would complete at the end of the year. Okay. So, you know, wait until January before you start filling out your 300A. And the posting requirement for the 300A doesn't start until February. Okay. But yeah, that's a very good point. I should have said that, right? So yes, if you're required to do record keeping recording, you would be doing the 301, the 300, and the 300A. Okay.
Thanks,
Good question. Mark. Yep. Let's go to the next slide. So we've talked about, okay, here's the example about the carve out this for the small employer. And let's read some of these bullet points, right? It says, for 10 employees or fewer at all times, right? So again, understand that it's a ceiling. So if in the summertime, you've only got 2-3 workers, but in the wintertime, you jump up to 12, guess what? You just broke the ceiling. So you're not a small employer. So if the company has 10 employees or fewer at all times during the calendar year, you do not need to keep the records. That's the forms. OSHA or the Bureau of Labor Statistics informs you in writing that you must keep records. I don't know of many companies that get that type of notification, but it does say that it is possible. But the last one I'll say is the part that I want to, again, reinforce. However, 1904.39, employers covered by the OSHA Act, that means you're regulated, must report to OSHA any workplace incident that results in fatality, inpatient hospitalization, amputation, or loss of an eye. So remember how I said earlier about partial exemption. So you're the small company, you got 8 employees. Okay, because you're small, you don't do the paperwork, the 300, 301, 300A, but you still have to report to us if you have the fatality or, you know, an amputation. So everybody has to do the reporting. Okay. And you can find that that's on, you know, in the OSHA book under the 1904.1 paragraph A1. Let's go to the next slide. Hit it one more time. I think it'll populate. There it is. Okay, let's talk a little bit about those numbers that I mentioned, because when you say 10 employees, how do I count that? Okay, there's a paragraph in the OSHA standard that describes it. It says, is the partial exemption for size based upon size of the entire company or individual establishments? And the answer is the partial exemption for size is based on the number of employees in the entire company. So if you've got, 2 employees at establishment 1, you got 4 employees at 2, 4, right? You add them up, that's going to be your count. Okay. So you wouldn't say at establishment 1, I've got 1 employee, I don't have to do recording. Establishment 2, I've got 15, I have to do recording. Now, again, we're going to count them and we're going to say, this is the size of the entire company. And if it breaks that ceiling, and the number again is 11 or more. So if you got 10 or less, you don't do it. If you got 11 or more, you're large enough to not be exempt. Could you still not be required to do recording? You can, again, back to that. If you're in that industry of low hazard, right? If you're selling shoes or selling flowers, that's just the 2 examples I always use because they're the ones that jump to my mind. But there are several industries that are not required because they're in what we defined again as a low hazard industry. Let's go to the next one. Here is Appendix A to Subpart B. This is the list of the low hazard, right? And it says the employers are not required to keep the injury if you're in these particular codes. And the codes we use are the NAICS codes, which is, again, the North American Industrial Classification System. It can be anything from 4 numbers to a 5, 6-digit numbering system. If you don't know what your number is, we can help you figure that out. These numbers are used not just by OSHA, but the insurance industry. This is how they classify a business. What is it that you do? Do you make widgets? Is it a hospital? Right? There's a number. I just put the bullet point at the bottom because the list is so long, but it says currently there are 72 specific NAICS codes that are listed as low hazard. So again, if you look at the QR code at the top, that'll take you to the list. This list is not always the same. Over years, I've seen it, it does change. I don't want to say it's the same and it's always the same. So you should be aware of what your number is. And because there were changes to this a few years ago, and I know we got a flurry of phone calls. Some companies were put into the list, but we had a few that come out of the list. So again, it's an important part to understand. Let's go to the next one. Maintaining and posting. Let's talk about that because people say, well, you're talking about all these forms and papers that I need. Do I have to keep those? And I said, well, actually you do. There is a requirement for retention. The retention period is 5 years. So you must maintain, able to produce, if so requested, records for a minimum of the last 5 years. Posting requirements, again, we said February 1st through the end of April 30th is the posting requirement for the OSHA 300-day summary. There are requirements, if requested, that copies of records be provided to former and current employees or their representatives. Let's go to the next slide. Here is a little flow chart. I always tell people this is on the website. Somebody put this together. I think it's helpful. I wish they would have another one of these, not just for reporting. This is for the reporting, and we haven't talked about it in any particular detail, but this is the requirement. There is an OSHA rule that requires companies that we regulate to report. And when I say the word report, I don't want you to think it's simply a phone call. It can be a phone call, but there is a way in which you can do it online electronically, so you don't talk to someone. But a reporting requirement is required if, as I said, there's a workplace fatality. The company must notify OSHA within 8 hours from the time they learn or made aware of the fatality, right? So there's a clock. The clock starts ticking. There's also a reporting requirement for any time there's an inpatient hospitalization, amputation, or loss of an eye. The reporting requirement on that is 24 hours. So again, if you use the little flow chart here, right, starting with worker is injured, first question, was it a fatality? Yes or no? Was the employee worker admitted to the hospital? Yes or no? Notice how the hospitalization says the word inpatient. So I guess I can describe that. If you're going to the emergency room, that is not inpatient. Inpatient means that you've been admitted. We'll say, you go out of the emergency room upstairs, right? So you're staying overnight. The reporting requirement on that type of injury is, as I said, 24 hours once the company is notified that the employee is hospitalized. The same for the amputation. And again, I think I got a future slide there that'll go into more detail. What do we define as amputation? But that's a good little, cheat sheet flow chart. Keep that or download it. Let's go to the next slide. We have 3 options of reporting. So again, stick with what we're talking about, reporting. The first is by telephone. I tell people that the easiest way to communicate with OSHA, you pick up the phone, you call the OSHA area office nearest to the job site where the incident occurred. Normal business hours are 8 a.m. to 4:30 p.m., Monday through Friday. Someone will answer the phone. There's always a duty officer, right, that's available, and just simply say, I need to report a work-related incident. So from that, we'll pull out a piece of paper and we'll start taking notes as to what it is. First thing we're going to do is define, is it something that is reportable? Fatality, inpatient hospitalization, amputation, or loss of an eye. If it doesn't meet any of those, I'll probably tell you, okay, well, what you're describing to me isn't something reportable. But if it is, yeah, we're going to probably, it takes 5-10 minutes to go through some of the questions we're going to have. First thing is we're going to ask when it happened, because we're probably going to start looking at that clock to make sure that you've reported it in a timely manner. But we'll ask, what extent of injuries? Well, the employee, had an amputation. Okay, what was amputated? How did that happen? So again, we're trying to get the information so that we have an understanding of what occurred. Let's go to the next way. There is, if you call outside the business hours, meaning that nobody at the OSHA office is there to answer, make sure that you still call, leave a message. You can call the 1-800 number, right? 321 OSHA. And the reason I say call during the off hours, I'll give you an example, right? Say if there's a workplace fatality that happens at 5 o'clock on Friday. Okay, remember that reporting requirement is 8 hours So that means you better be calling within 8 hours of notification that, hey, we just had an employee that was killed. Because we're going to check that to make sure that you're notifying OSHA. And as an example, yeah, if you do call us, at 2 o'clock in the morning on a Saturday, there is a hotline, right? Someone does answer that. And at a minimum, there's a way in which, right, a voicemail, you can leave the information. Because yeah, they're going to send somebody out if that resource is available, right? The area director gets a phone call in the middle of the night and says, hey, there was a fatality in your area, because the area director needs to know whether or not to send a compliance officer out, immediately. So again, the telephone is probably the easiest, the quickest way. Let's go to the next bullet point. I think the last example here says it electronically. You can go to the OSHA website. There's a link. You click on that. I'm looking at it here on my other screen, and it says to report a fatality or serious injury. And what you're going to do, you're going to fill out the form, right? The form will come up on the OSHA webpage, and you're going to start putting in the information. And again, as soon as you finish, you hit send, and it'll come to us like an email. So the last way I would tell, next, is there one more? Because I always tell people, you can always walk into the OSHA office in person and report as well. We don't get that a lot, but you can always walk in and report an incident. Let's go to the next slide. Go into a little more definition for the inpatient hospitalization. Again, OSHA defines that as a formal admission to inpatient service of a hospital or clinic for care or treatment. There is a carve out or an exemption. It says, do not report an inpatient hospitalization that involves only observation or diagnostic testing. So let me describe that. And we do hear about this because, again, if the doctor, medical professional says, we want to keep you overnight for observation. So again, from a doctor or healthcare professional perspective, right, they're worried about what could happen. So if it is for observation only, that doesn't meet that medical treatment, inpatient hospitalization, right? It doesn't meet that threshold. So that's why it's important for you as the company official. If you say, well, okay, we have somebody in the hospital, why are they there? Was it because they got, if you get hit in the head, I can almost assure you the hospital's going to want to keep you, right? Because they don't want you to to leave the hospital and you say you feel okay, but they send you home and, in the middle of the night, you have an aneurysm, right? And see, that would be bad. So if it is observation only, we, OSHA, we understand that that is for a procedure or for reasons that have not been established. So they're doing it only as a precaution. The other part of where it says diagnostic testing, right? Think of that like, taking an x-ray. Just because you get an x-ray doesn't mean that that is, that's a precautionary, right? Because if the x-ray comes back negative, then you didn't have the fracture they may have thought you had. So that's again, as a record keeper, we want you to record accurately as you can. So don't over record something that's not necessary to go on the OSHA log. Let's go to the next slide. How does OSHA define amputation? Okay, amputations, again, as much as we all like to think we know what that means, right? That, okay, well, somebody lost a body part. Well, there's a pretty good definition in the OSHA book. This is it in front of you. I literally cut and pasted it. But it does say an amputation is a traumatic loss of a limb or external body part. Amputations include limb or appendage that has been severed, cut off, amputated, completely, partially, fingertip amputations with or without bone loss, medical amputations resulting in irreparable damage, amputation of body parts that have since been reattached, right? So let's talk about that, because if somebody leaves the company with missing a finger, well, guess what? We found it. We took it to the hospital. They put it back on. According to this, that's still an amputation. Okay. So, and again, it's a common question. People call and they say, well, yeah, they lost their finger, but the doctor put it back on. Is that recordable? I'm going, oh, it is, absolutely. And it's reportable. Let's, turn that same scenario around. What if you go to the hospital and your finger's still on there, but the doctor says, hey, my medical opinion, it would be better if we just go ahead. That's not gonna heal. So we're going to take it off. Even if the doctor is the one who takes it off, that's an amputation. Okay. So again, it's important. I know some of this, you look at it or you go, wow, what does that matter? Again, I want you to record accurately. So we want everybody to follow and use the same way in which to define the particular injury, right? Let's go to the next one. How does OSHA define loss of an eye? This is one sometimes that has been tricky, because when you read that, people say, oh, you mean they can't see? No, that's not what we mean. Loss of an eye is a physical removal. The eye has been come out of their head. Loss of sight without physical removal is not reportable. Okay. So I wasn't the one who established the definition, but that is how that's how we look at it. So again, the eye would have to be removed from the head, right? Physical removal. So just simply losing sight does not make it reportable. Let's go to the next one. Electronic. Now we're getting through this. I apologize if I haven't taken enough breaks or asked for more questions, but so we've talked about two things, and this will be our last topic. But the first part we've talked about is recording, right? Stuff that we put on the paperwork. The second part we talked about reporting, right? When we have to contact OSHA. This is the last part. This is the electronic data submission. This is, I'll say, the newest part that came about within the last 8 years. This is also the part that just had a change that was announced last week. So it's important that you listen, because again, the same as what we've done with the other parts of record keeping, there are exceptions, exemptions, there are carve-outs. So you can be required to do this, but most companies do not have to do the electronic data submission. So that's why it's important to listen so that we can understand your company, do you qualify as to be responsible to do the electronic data submission? When I say that, you are going online to the OSHA webpage, you are creating an account to upload your information from your OSHA record keeping forms. That's what the electronic data submission is. So you're giving that information to OSHA, but again, it's not something that all companies have to do. So the first thing is, I'll say electronic data submission is for the first qualifier. You have to be a company that does record keeping recording, right? So remember when we first started with the small employers, 10 or less employees, they don't do the recording, right? Okay, then that means you're not going to be doing data submission. If you're in a particular industry that's the low hazard, yeah, you're not doing record keeping, logs, paperwork. So you're not going to be doing this either. Okay, so why is OSHA doing the data submission requirements? Because we see that companies have this information, but what it is, we're wanting companies to now provide it to us so we can look at it and start using it to see where injuries are occurring. Okay, so the first group, we'll say, and as the slide indicates, is companies, establishments that have 250 or more are required to do electronic data submission. So these are the big companies, right? We'll say this is the big employers. What must they submit? Right here on this slide, this is talking about the Form 300A. That's your summary, right? Okay. Let's go to the next slide. If the establishment is a little bit smaller, this is the second group. If you're between 20 and 249, you must do electronic data submission if you are in the list of industries that are considered high hazard. Okay, so again, I know these, I'm giving you more terms that you need to learn, right? More words. This list are going to be companies that are the medium size, 20 to 249, that are in industries that we believe to be where accidents occur. So I can show you what that list is, and I think I have a future slide here, but think of like anything in manufacturing. Yeah, that's going to be this list. So let's go to the next slide. Oh, and there it is. Okay, so if you have a company that is, what's the first qualifier? First qualifier is you have to do record keeping, right? So we're keeping the log. And you have between 20 and 249 employees for the year, right? Remember that cap, that ceiling thing that applies here as well. And if you're in any of the industries that are listed, again, these are NAICS codes. So it's taking a very broad, all of manufacturing, right? All of construction. And it does have 61, if you can see the bottom bullet point, 61 additional NAICS codes that are very specific. They can be found if you use the QR code, right? It'll give you the list of who falls into this category. And again, these particular people are the ones that are submitting the 300A, right? The summary sheet. Let's go to the next slide. And here's the ones that are carved out. So I'll talk about this one. If the establishment has 19 or less employees, they don't do any electronic data submission, right? So we still give a break to small companies that could be doing the OSHA record keeping, right? But because they're, we think small, we're not going to add to their list of, things that need to be provided. So again, that's why for electronic data submission, you got to know some of your qualifiers. What's the size of the company? What does the company do? What's their industry? Okay, let's go to the next one. This is the new part, and hopefully we'll get a question or two. This was only posted last week. July 21st, 2023, OSHA published a final rule to amend the record-keeping OSHA standard. It does say now that establishments with 100 or more employees in high-hazard industries must submit electronically information from their OSHA 300 log and their 301 incident reports. Okay, so this new category, remember we had the 250 or more did the 300A, 20 to 249 did the 300A in specific industries. 19 or less didn't do it at all. This is another category. This says if you have 100 employees or more, there's a list of high hazard industries. So you got to check that list to see if you're on it. You also have to include with your 300A, your 300, your log, and your 301s, all the incident reports. So that was a change, and that's a big change, right? So the last little part there says, right, establishments with 20 or more, high industries are routinely required to keep the information. But there is a fact sheet. I put that at the bottom. It is linked, but you can't click on it right now. But again, it'll be provided after the presentation. So this just came out like a week ago. And this particular requirement, again, doesn't start till January 1st. So, you got 3, 4, 5 months, right, before we really have to sink our teeth into this. So let's go to the next one. And if you want to look at that list for companies and industries that are considered high hazard with 100 or more employees, again, there were so many of them, I couldn't list them all. I counted them, it was 104. But I will say this group is actually, in my opinion, it's going to be smaller. Because if you can see, right, we didn't just lump in all of construction. We didn't just lump in all of manufacturing, right? We went through and we pulled 104 specific NAICS codes. So you can find that QR code at the top, hyperlink at the bottom, and let's go to the next one. This is the web page where companies that have to do the electronic data submission will go to, and it's on the OSHA web page. But what you are doing, you're going to the login.gov web page, you're making an account, and you're then uploading the information. So that is something, again, the website to upload your data for the particular year usually starts after January the 1st. But the deadline to submit it, which there is a deadline, is March 2nd every year. So at March 2nd is when we're going to expect companies to have their information and have that information uploaded. So let's go to the next slide. This here is our web page specific for OSHA record keeping. Again, I put a link on the bottom and a QR code at the top. This is very helpful if you have not used this before. There's a lot of information that's going to be on here. Forms. This is where you would get your OSHA forms. Has a lot of opportunities for questions. There's a page specific to frequently asked questions. I always tell people, if you're looking for something with respect to record keeping, you're going to probably find it on this page. Let's go to the next one. And as I said, question and answer search. If you're looking for something to determine whether or not something is a recordable case, if you were to type in under the keyword search, type in the word parking lot. Do I record an incident that occurs in our company parking lot? There's going to be, an example or a scenario, I'm sure, that will pop up, and you will be able to read that. So the question and answer search page is going to be very helpful, very useful. I would encourage anyone to look at that. Let's go one more. The on-site consultation, I'm very close to handing this off to the next speaker, because again, the consultation service, if you don't know what that is, I would encourage you, because each state must provide a consultation service, and it is at no cost. Here in Pennsylvania, the consultation service operates from the campus of Indiana University. This is something that is useful to all small companies, and I would encourage you to look into it. Let's go to the next slide. This is their webpage. I put this on here only, I'm not trying to steal any of Dave's thunder, because again, the service that they provide is very important. And I guess I always leave that point as, if I was a business owner, this would be something that I would utilize, because again, your tax dollars pay for it, and it's something that's available to you as a benefit, and you should be taking advantage of it by seeking out their services, because what they do, they can help small companies with compliance issues so that OSHA enforcement is not there, pointing something out to you that you could have easily corrected long before federal OSHA showed up. So the next slide, I believe, is just my contact information. Nope, that's my disclaimer. Let's go one more. And my information, I say it's my phone number, is the 1-800 number, but my email at the very bottom is the easiest way to get in touch with me, as I'm not in the office every day. But I'd be very happy to answer any questions that you have before I say that's all I have. I don't see any more questions in the chat. Nobody? All right, I'm probably going to mute my speaker, and I'm going to hand it off to Dave.
Thanks, Mark. And I'm going to suggest that if you do have a question for Mark, go ahead and put it in the Q&A while David is giving his presentation, and we will spend a few minutes at the end making sure that all the questions get answered.
Okay, great. Cindy, do you have my screen there?
Yes, I do.
Okay,
yeah, it looks great. Thank you.
Thanks. Okay. Well, thanks for inviting me in to participate today, folks. My name's Dave Yanuschik. I work with the Pennsylvania OSHA consultation program out of IUP. Some of you may have used this in the past. Some of you, this may be the first time you've heard of us. What the Pennsylvania OSHA consultation program is it's a free service for small businesses in Pennsylvania to assist those businesses in OSHA compliance issues, basically. So if you're like me, anytime you hear something is free, my first response is, yeah, right, nothing's free, somebody's paying for it, and that's true. So it's free to the user, which would be you as the small business. We're funded by federal OSHA, so the same pool of money that funds OSHA compliance in Pennsylvania, we get a portion of that to offer this free service. And in Pennsylvania, the state Bureau of Workers' Compensation kicks in a percentage of our funding as well. So essentially, IUP gets money from federal OSHA and the state to administer this free service through IUP. IUP administers the service for, or was chosen to administer the service for Pennsylvania because we have an accredited safety science department at IUP. So all of the consultants that work with the program that go out and perform the service, we're all faculty in the safety science department at IUP. When I say small business and medium-sized businesses, in different organizations you speak with have a different definition of what that is. For our purposes, a small to medium-sized business is less than 250 at the site, less than 500 at the corporate level. So that's kind of who we're geared to assist. We sometimes get requests from businesses that are under 250 at the site, maybe have 10, 20, 30 employees at the site, and have a larger corporation, larger than 500, but it may be in a situation where they don't get a ton of support, where, hey, look, we were just purchased by this big entity. We're kind of on our own, though. We don't get any support from them, any significant level of oversight. We'll go out and service those businesses as well. We just give them a little lower priority and try to get to the true small, medium-sized businesses a little quicker. But that's kind of who we're geared towards supporting. And talking about priority, we'll give the priority from our standpoint to visit as quickly as we possible the businesses that are a little smaller than the rest, and then are involved in particularly higher or hazardous operations than other businesses as well. Part of the free services we provide, and here are some of the things we do, kind of our bread and butter is physical hazard evaluations. So we come out to your facility, your job site, whatever it may be, and do a walkthrough, essentially, a hazard evaluation. Those evaluations can be either full or limited. What a full service evaluation is, we typically, when we do a full service visit, we tend to separate those usually by safety and health, just because there are so many different topics we could be looking at. If you request a visit, we typically would do a safety visit and a health visit. A full safety visit or a health visit is basically saying to us, hey, nothing is off limits. Go ahead and look at everything, look at our programs, our trainings. When you do your walkthrough, let's identify all hazards. That's a full scope visit. Sometimes we'll get requests from businesses that come out and they say, hey, we don't really want to look at everything right now in that discipline. We may have a particular concern with, for example, from a health side, hearing conservation. So can you just look at our hearing conservation program, maybe do some noise dosimetry, sound level surveys for us, and just focus on that? We could do that. So when we're on site at your facility or at your job site, you've invited us out. We're there to look at whatever you want us there to look at. So you're in control of the scope of what we're looking at. Some of the other free services we provide, like I just mentioned there, industrial hygiene monitoring. That can be part of a full scope visit. It could be just limited to that, whether it's air sampling, noise dosimetries, whatever it may be. We also do written program assessment. So we could take a look at your written safety and health programs, audit them from an OSHA compliance standpoint, determine if there are any gaps, and then obviously offer any recommendations we may have for you to improve those to improve your level of compliance. We do training assessment, so we can take a look at your trainings that you're doing, determine, hey, is this required from an OSHA standpoint, number one? Do you meet the standard for what you're reviewing? And then if not, we have recommendations we can make for you to get those trainings up to the regulatory compliance level. We have trainings we can give you to say, hey, look, here's, go ahead and take this template, use it as your own, feel free to modify it, do whatever you need to use it for your own purposes. We'll also do on-site assessments post-OSHA inspection. So oftentimes, a job site or a business establishment will have an OSHA inspection from compliance. Compliance will issue citations. Once the business and OSHA come to terms on those citations and agree to, hey, look, we agree, it's either an informal agreement, they formally contest it. Either way, once the terms are defined, that the business agrees, yeah, these are the citations, we agree to pay. If there's a monetary assessment there, and we agree to correct by these certain compliance dates, the business may need some assistance in understanding what they need to do, maybe some guidance. We will get involved from that standpoint as well. So business has an inspection, they just need some help on understanding what they need to do to meet the terms they've agreed to with enforcement. We can come out and help you with that as well. Also, what we do, and this is me specifically, what I do a lot of, it's evaluating the overall safety and health management systems for organizations and making recommendations to make improvements to your overall management system. Additionally, some things we do, not necessarily on-site, maybe a little more off-site, would be daily telephone calls and emails. We always have safety and health consultants on kind of phone duty each week to go ahead and field and return those phone calls that come in. We also do presentations, webinars, and seminars for businesses, oftentimes particular industry groups, or for local chamber of commerce, small business associations like you're attending today, and so forth. We also do some virtual assessments. So something that kind of came out of COVID for us was there are some situations we're able to virtually via Zoom and things like that. We could sometimes take a look at situations online, and is kind of, through the internet, we can look at some scenarios, maybe some pieces of equipment, whatever it may be, and do some assessments from that standpoint as well. So we have some capabilities there also. Like I had mentioned earlier, all the consultants that we use, if you put a request in for the service, we're all faculty based out of the Safety Science Department at IUP. It's just a lot of the folks that do this, we're faculty, we're just non-teaching in a faculty from a classroom setting with students. We're out trying to teach businesses how to, improve their compliance. Any consultant you'd have come out through our service, we're all board certified. So certified safety professional, CSPs, CIHs, industrial hygienists. So if you request a service, not only number one, is it free, you're also getting, highly competent safety and health professionals. Every one of our consultants come from the private sector originally. So we all have experience, working for manufacturing facilities, working in construction and insurance and all that. So we kind of have experience living in the world that you folks live in every day. Our consultants are also strategically located across Pennsylvania. So we have folks that are consultants in our program that are faculty at IUP that live in Philadelphia, live in Harrisburg, live in Scranton. And what that kind of does is just help us better serve our clients more quickly. So, since we are covering the whole state out of our program. If you put a request in for service, everything we do with you is 100% confidential. So we are not permitted to divulge any information, nor does OSHA enforcement have access to anything we do for you. You're free to provide the information we provide to you to whomever you want. If it would benefit you to provide it to your insurance provider, to provide it to enforcement during a compliance assessment, you're free to do that. We just don't provide it to anybody. Once again, whether it's enforcement, your employees, attorneys, or anything like that. So it's all 100% confidential. Separate from enforcement, if you invite us to come out, we don't issue citations, fines, penalties, anything like that when we come out. So you ask us to come out, we determine what the scope of your visit's going to be, and then we assess that. Now, the only catch is if we identify a serious hazard or an imminent danger hazard, which is pretty rare to come across an imminent danger hazard, but a serious hazard, you have to agree to correct that. And what we typically do is we give you a correction due date. Typically, we go out 60 days. It's pretty standard. So we'll say, hey, here's the serious hazard. Here's the OSHA requirement that requires you to correct this. We'll give you 60 days to correct it. All you have to do is by the time that 60 days is up, you give us written verification that you've corrected the situation, and we provide you with the documentation to do that. While you're working on correcting it, you are exempt from programmed OSHA inspections for those hazards. So we do the visit day one, we identify some serious hazards, we give you a time frame to correct it. If OSHA enforcement shows up the following week and say, hey, we're here for a program inspection. A program inspection meaning it wasn't an employee complaint, it wasn't a severe injury report, it was your business is part of this emphasis program, you triggered today, your name popped up, here we are, they'll leave. So they won't continue that program, the OSHA inspection, while you're actively working with us, okay? So you ask for the service, we identify a serious hazard, give you a due date to correct it. While you're working on correcting it, you're exempt from those programmed OSHA inspections. Here's another program that we have through our consultation program here at IUP, and it's called SHARP. Specifically, I lead this program for Pennsylvania. What SHARP is, it's a safety and health achievement recognition program. So over time, we'll work with businesses that develop very strong safety and health management systems and safety and health cultures, and statistically, they perform well over a period of time, meaning statistically their injury and illness rates are below industry average. Sometimes those businesses will want to try to achieve a level of recognition. So what we do is we assess their safety and health system, verify their injury and illness rates, and if they meet those criteria, we apply for this SHARP safety and health recognition program for them. SHARP is very similar to VPP, which some of you may have heard of, the voluntary protection program. SHARP is essentially the same thing, but for smaller businesses. So what goes along with that is it's a level of recognition that you could use to market yourself, put it on your website, whatever it may be that would benefit you as a business. We also recognize you from our standpoint. Additionally, businesses that achieve that SHARP certification or the SHARP designation we notify your local OSHA area office that you're in the program. And once you're in the program, they remove you from lists from program OSHA inspections. So you're essentially exempt from those random program OSHA inspections during the time you're in the program. Additionally, if you're in the program and you experience one of those severe injuries that Mark was talking about earlier, where now you have to call and notify OSHA where, hey, you had an amputation, a hospitalization, whatever it may be. The agreement we have with the area office is if you do that, you then also notify us. We will follow up with you in lieu of receiving an OSHA enforcement inspection, being that you're part of this program. So that's just another benefit as well to being sharp recognized, essentially. And something that kind of recently came about, if any of you folks that are participating today work in the construction sector, traditionally these sharp establishments have been all general industry, like manufacturing type facilities. We recently received the authorization to move forward with having sharp designations for construction job sites. There's kind of the separate level of criteria that goes along with that. And if any of you out there are in the construction sector and you want some more information on that, feel free to contact me after the presentation today. But that's kind of something new that we're going to be working through here in the upcoming years. Now, as far as requesting assistance, you see our 1-800 number there. Also, the OSHA website, or pardon me, our website for OSHA consultation. This is the same site that Mark had showed earlier. You can go to our website. There's a tab there that says request a free consultation. Click on that, fill out your company information, hit submit. That'll go to one of our admins. Based off of what you're requesting service-wise and where you're located geographically within the state, we'll assign safety and health consultants to you. You receive an email confirmation of that. After that, it's up to you, between you and the consultants, to go ahead and determine what specifically you're looking for, determine your visit dates and so forth. So it's a pretty easy process. Additionally, on our website, we have some testimonials from prior businesses that use the service. And actually, a lot of these businesses here are businesses that have achieved that sharp level over a period of time. So you can kind of see their experiences with the program, pretty quick, short informational videos. Additionally, just something else I'd like to let you know of is there's a free safety and health training service through the Department of Labor called PATHS, which some of you may have used in the past. Some of you may have never heard of it before, but it's a great resource. You can go ahead to their website. They do free safety and health training, both in webinar format and on site, in a variety of topics. So you can go ahead and sign up for a topic that they already have on their calendar, or request a topic. So once again, great free resource there from a safety and health training standpoint, and just wanted to throw it out there to everybody participating. Do I have any questions, or does anybody here have any questions for me in regards to the program? I can go ahead and open that now. I don't think any came through the presentation, but you could ask now, or feel free to reach out to me. There's my email address. There's my direct phone line at any point in time.
So David, thank you
Yes.
so much. Great information. And as everyone is thinking about their questions, I would like to say that if you would rather speak to provide, just because maybe it's too hard to explain your question, I'd be happy to unmute you and give you an opportunity to do that. And if you want to just, I think I have the ability, you have the ability to raise your hand, and then I can unmute you. You can also mention it in the chat. So David and Mark, gosh, great information today. So we very much appreciate it. I do, something that we were talking about before we started the webinar today is, obviously you are all looking for information on OSHA, and we're interested, as we plan for 2024, to know what other topics you would like to hear about. And we choose those topics based on your feedback, and then we line up those topics for 2024. So feel free to add that to your evaluation. With that, I did want to say that after today, we will be sending you the PowerPoints that you saw, along with the recording of today's webinar. I'll also be sending you an evaluation, and that form will come through your email. It should only take you a minute or so to complete, but it does give us valuable information. I'd like to take a moment and give Sandy Wheeler from the Gannon University Small Business Development Center a chance to say a few words.
Cindy, thank you so much. I just want to thank everybody for joining today, and of course, Cindy for hosting along with us, and Mark and Dave. What Cindy said, thanks for sharing your valuable information, and we're looking forward to continuing the partnership.
Okay, thanks, Sandy. With that, I don't see any questions. So Mark and Dave, thank you very much. We look forward to the next webinar, which will be actually taking place. It'll be a hybrid event on September 28th. The location of that event will be in Greenville. The topic will be fire prevention and emergency preparedness. So September 28th, 10 a.m. virtual as well as in person. So we encourage you to take a look at that. I'll be sending out the link to sign up for that with my follow-up information. And then to round out the offering for this year, on November 30th, we will be hosting a webinar that speaks on employee training requirements. So that's a topic that probably will be applicable to every business out there. So we hope that you plan to attend. Okay, so with that, thank you everyone for joining us, and we look forward to having you join us in future events. We wish you all a great day, and final thanks to our speakers. Take care, everyone. Bye-bye.